All right, today we're going to talk about treating QL pain. Okay, QL again is that muscle that spans from the lower part of the rib cage to the top of the pelvis. Okay, we've established that it's not any disc injury or any real joint injury. We're just probably dealing with some sort of muscular strain related to usually rotational sports in the average athlete, right? And we're going to start with what we call soft tissue treatment or active release ART treatment on this QL. So I'll show you how we go about doing that. So active release treatment is pretty straightforward, okay? What we do is we locate the area and we shorten the muscle involved. And what we do is we apply tension to a shortened or contracted muscle, okay? So you can see the job of this muscle is to bend the rib cage to the pelvis, right? So that's what we're doing with this motion. I'll grab some tension on that muscle here. Alyssa's right QL. And then what we do is just lengthen that muscle under tension. And you see we're able to utilize this table here to help us do that, okay? So this feels really good. I always say ART treatment feels like a good mixture of a deep tissue massage and a really good stretch, okay? Alyssa, that feels pretty good?
Yeah.
So we usually do about 4 or 5 passes here of ART to loosen up the structure, or really however long it takes for us to feel that tissue really start to relax. All right, so the next part of treatment usually after we do our soft tissue is to treat the QL with, or the area of the Q, that area of the lumbar spine near the QL with some sort of high velocity, low amplitude or chiropractic adjustment. So what I'm usually feeling for is motion restrictions in this part of the patient's spine. Okay, so we've already established that Alyssa's got some sort of fixation here. So what we'll do is we'll adjust her in this position. And what you'll see normally is you'll see that normal kind of chiropractic adjustment that you're used to seeing everywhere. We're not going to really adjust Alyssa today just because we've already adjusted her earlier, but I'll show you the position of setup we're going to use. So what I like to do is I like to establish a lot of lockout here in this area of the spine. This way you're not feeling a lot of my force, okay? The joint is already kind of ready to move. You know when you do that stretch in bed where you're kind of like holding your leg off of the bed and bringing your shoulder backwards is essentially what I'm doing here. I'm just adding a little bit more force at the end, okay? So that's a big one there. That helps treat that lumbar spine. It can help knock some restriction out of that SI joint where that muscle in particular attaches. Alyssa, go ahead and lay on your back for me too. So I'll also treat that area of the rib cage too. Remember, it originates from that lower rib. So I'll have her cross her arms here, roll towards me, big deep breath in, all the way out, and then just a little push like so. Again, not a ton of force involved in these types of adjustments, but sometimes we do get a decent amount of noise, especially with the patients with the tight QLs because those joints are just being pulled on all day long.